Hey everybody, Coach Kyle here. So we've been talking about anxiety, but for our video today, I want to step back a little bit and talk about mental health diagnoses in general. So there's kind of this misunderstanding with a mental health diagnosis versus a physical health diagnosis. And a lot of people think they mean the same thing, and the truth is they don't. And we should actually have a different term for one versus the other. But this is what we've landed on for some reason. So when you go to the doctor, you're experiencing symptoms. Uh, Say I fell, my arm really hurts, it's swollen, it's bruised, I can't move it without pain. Those are the symptoms I'm experiencing. I go to the doctor, get it checked out, get an x-ray done. I broke my arm. Okay, so my diagnosis is a fractured bone. That's the cause of my symptoms. That fracture is the diagnosis and the cause of my problem. Okay. Now let's compare this to a mental health condition. Say I'm experiencing intense anxiety, it's affecting my quality of life. I go see a therapist or my doctor, and I'm given a diagnosis of generalized anxiety disorder. Now, in this case, the diagnosis I've been given tells me nothing about the cause, nothing at all. What's causing my anxiety? No idea. So in the mental health field, when you're given a diagnosis, it tells you nothing at all about what's causing your problems, what's causing your symptoms. All it's really doing is labeling your symptoms. Your symptoms fit within a clinical classification that we've given a label, generalized anxiety disorder. So this is very different, right? When I'm given a diagnosis of a fractured bone, that's the cause. That's what I need to fix. That's what I need to address. When I'm given a diagnosis of generalized anxiety disorder, what do I do with that? What do I fix? What do I address? What do I work on? So what can happen is people they identify with their diagnosis and they see their diagnosis as the problem to be fixed. I need my anxiety to be fixed. I want it to go away. What can I do to make my anxiety go away? But this is a flawed way of thinking and looking at it because anxiety is not the problem. Anxiety is the symptom, right? This would be like looking at that broken arm as um, the swelling is the problem. I need to get rid of the swelling. If I just totally focus in on my arm is swelling, I need to get it to stop swelling. Okay, I might put ice on it. I might put heat on it. I might wrap it tightly in something to make the swelling go away. But I'm not addressing the root cause. I'm ignoring the real issue. And that swelling in that case is helpful. That swelling is part of the immune response. It's helping to heal the fracture. It's helping to protect that area. All the other symptoms are the same: the pain, the bruising, the the difficulty in moving it. That's all to protect me, to protect the problem and help to deal with and heal the problem. Yet in mental health with generalized anxiety disorder, I'm looking at the symptom as the problem. I need to make the symptom go away. Well, the symptom is there to help us. It's there to protect us. The symptom is there to let me know something is wrong. The challenge here with mental health diagnoses is that the actual cause isn't so apparent. It's not as obvious much of the time. And very often there's multiple factors coming all together in a specific way to cause the symptom. So with anxiety, like an obvious problem might be I'm in a legitimately dangerous situation. Maybe I'm stuck in an abusive relationship and I'm actually in danger much of the time. Well, yeah, I'm going to feel anxiety. I should feel anxiety. That's my brain trying to help me get out of danger. And again, in that situation, the anxiety is not the problem to be solved. Getting me out of danger is. Now, often it's not so obvious and apparent. I mean, it could be a lot of seemingly innocuous stressors that I, through avoidance, which we talked about in previous video, through consistent avoidance, I train my brain to amplify that sensation, that symptom of anxiety. And now I'm just experiencing a lot of anxiety for not so threatening things. So in that case, the problem to be solved is my behavioral patterns, my emotional patterns, and my thought patterns. And maybe lifestyle, and maybe eliminating some of these threatening things in my life. But it's complex and it's nuanced and it's not as clear and cut and dry as a broken bone, right? But that's the big difference between a mental health diagnosis and a physical health diagnosis. So don't get yourself trapped in the idea that your mental health diagnosis is your problem, that has to go away, that has to be solved. This is where we need to be digging in to discover, to learn what's actually driving your mental health symptom label, not diagnosis, not cause, but the label we've given your symptoms. What's driving those? And this can take a lot of hard work and a lot of self-understanding and self-discovery and self-analysis. And like I said, it might be a lot of little things, but don't let your mental health diagnosis define your life. Don't let yourself see that as the problem that needs to go away, because it's not. Most of the time, with rare exceptions, a mental health diagnosis is not a problem, not something broken. It's not your brain malfunctioning. It's your brain doing exactly what it's designed and supposed to do to protect you. This is where we need to be looking at these symptoms like, what is it trying to tell me? How is it trying to help me? The symptom itself is not the problem. The symptom is the signpost that's there to alert us of some other problem. So let this information empower you. I know it can feel, it can make us feel angry. It can make us feel upset when we first hear things like this. What do you mean? What do you mean my diagnosis is not the problem? You don't live with my depression. You don't live with my anxiety. Yes, I know it causes problems, but they're symptoms of a deeper problem or set of problems. So let this information empower you to investigate, to get curious about your symptoms. What's potentially actually driving this that I can take action to address and correct and fix? So many of these mental health diagnoses are so hard to resolve because we're not looking for the answers. We're not looking for the underlying root causes. We're just so focused on making our symptom go away. So I'll leave it at that. We'll see you next video where I'm guessing we'll dig deeper into anxiety too, but I felt like I needed to have this discussion first. And yeah, we'll see you next time. Take care. Bye-bye.